Hi, this is Brian Kim. I'm going to share with you this case of a patient who had an atypical membrane on the anterior surface of the lens. Now, I do have some patients who will develop this membranous material with a spiderwebby consistency on the anterior lens coming from the capsulorhexis edge, and you can just laser those away. But this patient actually had a dense membrane over the entire lens optic. This patient had a star plate haptic IOL, and I'm not sure if the design or the lens material itself contributed to this membrane. I actually tried to YAG the membrane, and all it did was pit the lens, and it did absolutely nothing to the membrane itself. And so I wanted to share this case and show you how I handle this. So I go ahead and make my paracentesis incision, and then I'm injecting some BSS into the anterior chamber, and I'm just trying to see if I can tease it off with the cannula. And as I'm pushing, I'm noticing that I'm not really making a lot of headway by pushing the material. It's pretty densely adherent to the anterior lens surface. And then I have this diamond dusted polisher that one of my partners used to use to polish the posterior capsule. It has an irrigation port so you can keep the chamber stable. And so I'm just kind of pushing around to see if I can polish it off with this instrument, but to no avail. This is a very adherent membrane on the anterior lens surface, and none of the maneuvers are actually working. And so I chose to use these MST micrograspers, and you can see I'm actually peeling this membrane as if it's like a capsulorhexis. And it's so firmly adherent, but once I grab an edge to it, it's fairly easy to peel off. I was able to remove half of that membrane, and I'm starting to remove the remainder of this membrane. Again, it's like doing capsulorhexis. I've never seen a membrane like this before. So that's really the end of the case. I go ahead and hydrate my incisions. I saw the patient postoperatively. She distinctly noticed a dramatic improvement in her symptoms, and she's scheduled for her other eye. So in the future, if you encounter a strange, atypical anterior lens membrane, know that you can go in surgically, peel it off like you're peeling off a capsule during capsulorhexis, and the patient should do well. So I hope this was helpful to you. Please like and subscribe, and I thank you for your attention.